The response to COVID-19 has been laden with poor information, bad information, and sometimes straight up misinformation. A big issue right from the start has been the subject of face masks. How essential are they? Are they important at all? And what role are they going to have going ahead? There's been a lot of uncertainty over this by both governments and even the World Health Organization, but now new research based on mathematical modelling by the University of Cambridge and Greenwich may give us a good answer. Before I get into the study, I want to mention an important concept that I'm going to be talking about throughout, which is reproduction number, or R number. R number is the average number of new infections that is produced by a single person who currently has the coronavirus. Keeping the R number below 1 prevents exponential growth, like seen here. 2 becomes 4, then 8, 16, 32, and on and on and on until thousands or hundreds of thousands. Okay, let's get into it. Researchers used two models of disease spread. The first is called the branching process model, which are frequently used to study how quickly things, like humans, bacteria, names, viruses, reproduce. The most important thing in a branching process is that it accounts for the fact that reproduction is a bit random. Not every person will infect 2 people, for example. Some could infect more, some could infect less. Just like how a family could have 5 kids, 2 kids, or no kids. There's a good amount of randomness to it and it needs to be accounted for. Now, here comes the research bit. By putting in different variables, you can model their effect on the branching process. For example, if the researchers tell the model to give a certain percentage of people a face mask, and also tell the model how effective a mask is at stopping the spread of a virus, then the probability of a branching process is going to shift. Also, by taking data that we know about what proportion of people are asymptomatic and symptomatic, they can also model in the effects of if everyone wears the masks or if only people who display symptoms begin to wear masks. The second model that they use is called an SIR model. These are frequently used in epidemiology all the time. The letters stand for susceptible, infectious, and removed. At its core, an SIR model looks quite like this. You begin with a population of 100% susceptible people, you then expose them to an infection, and then you track how rapidly it spreads throughout the population. Again, all of this is in a computer model. They didn't go around infecting people with a virus. They used up-to-date data in order to predict how fast the virus spreads in the population. SIR models are great because they can be easily adapted based on the variables that you input. And this right here is what the researchers put in. Absolutely beautiful, isn't it? Okay, I lied. It looks horrible and terrifying and full of algebra, doesn't it? Right, let's break it down together. First of all, what they're doing is they are grouping the population into 2 distinct groups. People who will wear masks and those who won't. Each group's infected individuals has a specific chance of releasing infectious droplets whenever they talk, cough, or sneeze. These droplets are called inoculum. The chance of releasing them is reduced by a certain chance when they wear a mask. This is shown by the M. The droplets themselves are infectious, but they also land in surfaces, making the surface infective, also called fomite. On a surface, the infectivity will begin to decrease over time, hence decay. In both cases, these droplets have a certain chance to infect a susceptible person, again, less so if they're wearing a mask. If they become infected, after an amount of time, they will then become exposed, then infectious, both asymptomatically and symptomatically, until after a while they are removed. Either they've recovered or they've died. And there we go. By assigning distinct and backed up data to each of these variables, the researchers established a very powerful tool for investigating how important masks are. Now let's look at the results. Okay, the first piece of data is a heat map. By using data about the virus's natural reproductive rate and then telling the model what percentage of a population is wearing a mask and how effective a mask is, it can then tell us what the resulting R number, remember the thing I talked about near the start, what the effect of the R number is on the population. Overall, the message here is that the bluer the greener the map, i.e. the closest it is to 1, the better. The data in this way really speaks for itself. The R number is pulled much closer to 1 when everyone wears a mask all the time in public than if they only wear them after they start showing symptoms. What's more, it's essential to keep this number as close to 100% of the population wearing masks, as even going below 70% it becomes a lot less safe. There is already a lot of evidence right now that even a cotton t-shirt turned into a mask is well over 50% effective and could well be over 90%. With this in mind, it seems wearing made-at-home masks by as many people as possible is a very affordable and effective way to minimize the spread of coronavirus. Overall, this research, based on assumptions supported by other research, strongly supports the use of made-at-home masks for the entire population. If people can get them, an N95 respirator mask would also be even more preferable. At the moment, very few countries are forcing, or let alone even recommending, that all people in public should wear masks. It is, however, clear from this data and others that the use of face masks is going to be vital in the prevention of a second wave of the coronavirus. What's even better though is that the availability and the cheapness of made-at-home masks make this a viable and very cost-effective action available to all countries, both high income and low income, that is almost certain going to save lives. The key to face masks is that they both protect people from droplets getting in, but they also limit the number of droplets that get out if they are infected, and especially if they are asymptomatic and unaware of this. So, keep your distance, wear your mask, stay safe, and thanks for watching. Finally, to finish, I'd like to thank the author of this study, Dr. Richard Stutt, for his contribution of this research, and hope it makes a strong impact in limiting a second peak.